I'm a surgical nurse upstairs. I'm going to go over some of the stuff that you guys are going to do. You guys have a lot of labs today to go over, but just to kind of get you started. Of course, first you're going to have your patient. It'll be in the trough. Can you guys hear me if I put this down? Just so, or how can I? Okay. So you guys are all going to have a trough, and you have your little patient that's in there. These are the leg ropes. We'll have his legs tied down. He'll have a clipped area. Can you guys all see? This is the clipped area here that we're going to be preparing for surgery, okay? Everybody's going to have a prep set. In the prep set, you're going to have one exam glove. You're going to have chlorhexidine. This is your surgical scrub. This is a bottle of just regular tap water. This will be your final spread for your final preparation after you're done doing your scrub. And some 4x4s. We also have instructions. If you have any questions, you can always refer to the instructions. So we've already clipped the animal, so the first thing we're going to do is we're going to take some of our 4x4s. We'll wet them down with some of the water. Oops. We'll get them nice and wet. And what we're going to do is we're going to start at our incision site, and we're going to wipe out. This first prep is just to get the area clean. You want to get all the debris, all the dirt, all the hair out of the way and make sure that the skin is nice and clean before you start your final prep. So we'll start here, and we're going to wipe out. We'll get rid of the dirty one. We'll get another clean 4x4, start at the surgical site, and work away. We're always going to wipe from the incision site out to the hair edge. We're never going to go from the hair edge back to the incision site. Okay? Same thing for the final prep as well. Now we're sure he's nice and clean. We have all the debris off. The skin's nice and clean. Then we're going to go and use our surgical scrub. Same thing. We're going to take our 4x4s. We'll add a little water. We'll add a little soap. We'll get a good lather started there. We're going to take our exam glove. We'll put that on our hand. And then we're going to take our scrub on our 4x4s. You can kind of pull each corner in, and you're going to start at the incision site. You can go up and down, you can do little circles, just as long as you don't do this. Just start in the center and work your way out to the edge. When you get to the edge, kind of wet things down, and then throw it away, okay? You're going to start all over again. A little bit of water, a little bit of soap. Get some bubbles going there. Pull your corners in. And then start your scrub at the incisional area. Okay? And then work your way out. Once you get to the outside, you're done. Okay? Now that we're all done, we normally would have some sterile 4x4s for you at this point, but we're just gonna, just for practice sake, you can use one of the 4x4s. We're gonna, same thing, to dry them off. We'll start at the incision site, work our way out, get it nice and dry, and then we're gonna use our final prep. And then we're just gonna give it like just a little shine of the alcohol and Novosan spray. And then you guys are ready for surgery. So we'll get you positioned.
This is Nurse Reburn. You were here before, right? Yeah. Everyone knows Nurse Reburn. So she's going to show you the another detail of preparation of the surgical patient. In this case, we're going to use as an example preparation of the limb. But I mean, there's some other slight differences in how the products we use and that sort of thing between the two hospitals. Keep in mind that there's many variations in surgical preparation, many of which are absolutely acceptable.
Okay, so I'm going to show you guys just a quick prep that we do for the lower extremity. So Dr. Richardson is modeling a stat law. maybe, there might be a carcass, I don't know.
Let's
But that's
pretend
our-
we're doing this is supposed to be a fetlock.
And there's our hoof. So what we do is same essential principles is that you want to first get all the gross contaminants off your legs. So what we do is, because we have usually a larger area and we can afford to be a little bit messier and use more water at New Bolton Center, we will use jugs of water or hoses to actually just dump on things. So what I do first always is I'm going to use a used scrub brush and we'll clean the hoof off really well. We'll use lots of, we use chlorhexidine usually as our gross prep. So we'll just dump that on there. You're going to clean it all off, lots of warm tap water, and the idea of getting as much of the gross contaminants off as you can. And I start with the foot because it's usually the dirtiest. And then what we'll do is get rid of that sponge, new gloves, and you're going to do the same thing. Lots of water, lots of soap, scrubbing really hard and aggressively, getting all the gross contaminants off. 360, doesn't matter if you go up into the hairline a little bit, you're going to get everything rinsed off. What you usually will see is kind of the water will start to bead up. Your soap suds will start to have no more contaminants in them. They'll be nice and white, there won't be hair you don't see. And once you get to that point, we like to do what we call a white glove test. First, since we're not doing surgery on the actual foot, we're going to cover it up like that.
Non-sterile gloves.
Non-sterile gloves, which again, these are the over gloves that the surgeons wear. You know, we like to reuse as much as we can. And then we'll, same principle, alcohol on 4x4s, non-sterile. And now is when you want to start really thinking about the aseptic technique of clean and dirty areas. So even though we cleaned our foot, we're still going to consider this a dirty area. And our hairline is actually also going to be our dirty area. So our incision site is going to be around our fetlock, which in this is, you know, the middle of where we clipped. So what I like to do is take my 4x4s and wipe and look and make sure that we've actually gotten all the gross contaminants off. Because even though you scrubbed it really well, there might be some hairs or whatnot still on the leg. So we're going to do that and make sure that we go 360 all the way around. And as you see, if I'm wiping from the incision site outwards, I'm not going to use that same 4x4 after I've hit a dirty area to come back into my clean area, which is why I'm removing and using so many 4x4s. So you get the idea there all the way around. So once that's done, if you have more gross contaminants and you can't wipe them clean, then you would do another gross prep to get everything off and do the same thing again until you've established that you have no gross contaminants on your area that you're going to do your final prep. And then what I'm going to show you today is the Draping, which is a product made by 3M. It's really nice, it's quick, it's iodine and alcohol mixed together, and it leaves a nice film, and it has a short duration of what it needs to be left on there. It's only 2 minutes before you can drape, which is plenty enough time.
It's an iodophore. Oh, it's not iodine per se, okay? It's complex with polyvinyl pyrrole.
Right.
So it's an iodophore complex iodine, not inorganic iodine.
Okay. When it's fast, we like it, but it is expensive. So it comes in a sterile package. I'm not going to break the seal. What you do is hit that top, and then it would fill your sponge. And then we go all the way around. And then you want to start thinking about clean and dirty. So I'm going to keep a dirty edge and go all the way around. And then I'm going to flip it, because we're going to think about gradients of cleanliness. So I'm getting closer to each of my dirty sides as I go along until you reach the edge, and then you're done.
Questions? You'll notice that there's a couple of absolutely fundamental points that get reiterated over and over again, one of which is clean it, all right? Get rid of the gross debris, both in any species. You get the hair off, get the basic filth off. After the basic filth is off, then it's just a matter of making sure that you have contact time with an appropriate antiseptic. The other principle that you see applied over and over again when people are doing proper surgical preparation of the patient and as well as the surgeon is this concept of a gradient. Both of the nurses were describing that they work outward from the center. The same principle applies when you're preparing yourself. We talked about that last week. And will also apply when you start talking about the draping. So always concentrate with aseptic technique that you're thinking about the center of your field being the cleanest, and it gets dirtier and dirtier the farther out you get. Okay, just to always keep that in the front of your mind. All right, so no questions? No questions? Okay, then we're going to go ahead and proceed to some examples of different techniques in draping. Yes, go ahead.
The gloves that I guess you guys put on, you can just put on gloves. It doesn't have to be like an open or closed
No,
like
it's
gloving.
just a regular exam glove that comes in the boxes.
Those are non-sterile gloves.
Yeah,
Okay.
they're non-sterile.
Okay.
Any other questions? Yes, ma'am.
I can't remember what it was called, the iodine divinity brush.
Sure, perhaps.
Yeah. When you were flipping it, you're keeping, there's one edge that is the cleaner edge, and as you're flipping it, you're keeping that clean edge
Towards
the center.
Yeah. But especially when you're doing extremities, you want to think about, even though there's an incision, even in arthroscopy, there's going to be multiple points, so really 360 is the clean area as you work away. It's not like one plane of the leg is your single incision site usually.
Other questions? Good time. You can ask also in the lab. All right, so now we're going to show that the simplest technique of draping is to use a fenestrated drape. In other words, a drape with a hole in it. Everyone, any Latin majors in here? No? Fenestra, meaning window, okay? So when you see a drape that has a hole in it, that's a fenestrated drape, okay? Now, when you use paper, okay, you can cut a hole in the drape, and that makes a big difference in terms of the ease of using fenestrated draping technique. So to start with, okay, I'll show that basic technique of how you would drape if you're using a fenestrated draping technique. That is, say, if we've got our little gorilla here, okay? There's a couple of really fundamental points here about draping this with a fenestrated drape. One is that the most important thing to think of when you're using a drape, where you're applying the drape on top of the surgical field, is that you can't drag it to the surgical field. You must place it directly on top. Okay? So what we're going to do here is open up this drape, okay, and hold it in some means where my hands are covered, because I'm sterile at this point. I'm wearing a gown, cat mask, okay? You have to use a little imagination here. So I'm properly garbed here. And then, so that means I want to keep my hands absolutely sterile, because I've got sterile gloves on. So when I'm approaching the patient, my hands are always covered up, okay? They're covered up like this. Now this is a little tricky, and you'll have to practice this in the lab. And the way to do this is you always leave one double thickness at the edge of the drape. You can see it's turned over there, right? Everyone see that? So it's double thickness on the edge. Put your thumb over the top of it, like so. Got it? Then you simply do this. This is really not that complicated. Is that you point your palms towards your face. Got it? Everyone got that? Then what you do is you point your fingers towards the ceiling, like that. Got it? Then what you do is pronate your hands, palms going away from you. You turn it like that, and then your hands are completely protected when you go to drape. Right? You can practice that in the lab. So thumbs over the top, palm towards your face, turn your fingers towards the ceiling, rotate your hands in like that, and your hands are properly covered. Now, some of you will have seen in small animal practice, you don't do it like that. Some small animal surgeons will say, oh, it's silly. Don't listen to it. Okay, the reason they say it's silly is because if you're doing small animal surgery, another technique that works absolutely perfectly in small animal surgery, when you're using these absurdly small drapes, is that you can actually put your fingers right in that crease on the outer edge and put your hands in like that. It's even simpler. In other words, you just put your fingers and turn them in like that. Does that make sense? However, in horses, a standard horse drape is a minimum of like 60 centimeters on the side. And unless you yourself are a full-size version of that gorilla, you're not going to be able to reach all the way to the edge. Okay, so I like to teach it this way because it's applicable to all species. Okay, all size drapes. Thumb over the top, palms towards your face, turn your fingers to the ceiling, pronate your hands, and you're there. Okay, now, if I'm walking up to my patient here, all I really have to do is manage not to hit this drape up against anything that I don't want it to hit. Another thing to keep in mind, what is my face mask? Is it sterile? No. So when you start moving around the OR, you don't do this, okay? Which we will see, okay? Because then you will hit yourself in the face on your non-sterile mask. So keep your hands extended, arms out. Always keep your hands where you know where they are. So we're going to go to our patient here, and I'm going to sit there and go, yeah, I know exactly where I'm making my incision. It's going to be in the abdomen, ventral abdomen. So all I have to do is go over the top and drop, and then put my hand there so it doesn't slide. And then I'm going to put my towel clamps in, which we'll get to in a bit. Got it? Now what you can't do, okay, what you cannot do if you're using this technique is get everything prepped and then go like this, right? Because what you've done, if you do that, is that you've dragged the underside of the drape from a non-sterile area onto your sterile site. So you must drop it down directly from above. And you can't adjust it at this point, period. You can't say, I really don't like the way that crease is lying, just doesn't suit me, I want to pull it right there. You can't do that. You've now dragged it from a non-sterile area to a sterile area. Everyone got that? That's easy, because then if you're using this drape, once you get it in place and you can't clamp it in place, all you have to do is take scissors and cut a hole where you want it to be. You fenestrate the drape. Some of you have seen cloth drapes, or there's actually disposable drapes that already have a pre-cut fenestration. Now, if you have a pre-cut fenestration, it's trickier, because in that instance, you have to be even more precise, because you have to be sure that when you put the pre-cut fenestration on, that it is precisely where you want it to be, okay? Which isn't that hard. I'm not making, this isn't all that difficult. Got it? So that's the simplest form of draping, is you just plop it on the gorilla, and that's that. Or is this really an orangutan? Anyway, you just plop it. You don't drag it across. That's number one. Okay? Now, any questions about that? Now we're going to move to what's often called square draping or corner draping, or all kinds of. Yes, ma'am.
I've had clinicians or surgeons, they cut the drape first when it's an accordion and then put it on.
Same thing. It's just that you're making life harder on yourself. But some surgeons are simple. Now, in all seriousness, there's really no good reason to make the fenestration before you put it on. But, you know, if you want to, I mean, everyone needs a little challenge day-to-day life. But you don't really need to. You can always put it on and then cut the hole. Now, you can't do that if you have cloth reusable drapes, right? So that's the issue with the fenestration. Any other questions? Okay, now we're going to square drape, or corner drape. The key with this is not contaminating yourself, as well as, you know, using the same principle of thinking about a gradient. The center of the incision is still the thing that has to be kept most clean. So, same way, over the top, fingers towards the ceiling, rotate, my hands are protected. Now, what I'm going to do is I'm going to decide what is the safest place to put my first drape. In this case, this animal is pretty symmetrically arranged, so I can get to this from any side of the table. This is not going to be true in a horse. There's no place in the horse where there's always, you know, when you're draping a horse or a cow, there's always some part that's really hard to get to. Okay, a dog, it's a little easier. A cat's even easier because you can get all around the table usually. So it depends a little bit on the size of your animal. And this little mini primate here is easy. So I'm going to go at it. Now here, I'm going to drop it on, and I'm going to have, this is a worthwhile thing to sort of just remember as a general, easy way to do it, is always try to get the edge of the drape in the middle of where your incision is likely to be. Okay? The reason is because if it's in the middle, you can now drag it towards the periphery, because you haven't done anything bad there, right? Because the center is clean, the periphery is dirty. So you can put it in the middle and then pull it slightly back until it's where you want it to be. Now at this point, things get a little bit variable depending on the exact circumstances. If I were to let go of that drape, if I were to put that drape on in a place where the second I let go of it, it fell on the floor, it didn't do much good because you're not going to pick it up off the floor. Everyone agrees with that? Okay, so if you have to put a clamp in it as soon as you put the first drape on, you do so. When you work in the lab upstairs, you're not likely to have to do that because they're big tables, small patients. They're not likely to fall off. So you can usually just drop it. Now, you notice one thing I didn't do. This is important. And every one of you anal retentives out there, you know who you are going to have to resist the temptation to do what I just did there and then do this. Okay? To straighten out. I mean, you know who you are. Okay? You all made your bed this morning. Okay? The ones of you who are like that. Me, I'm pretty sure I did. Anyway, you get the idea. You don't want to go to, this is clean drape. Everything out on the edge becomes dirtier and dirtier. Stay in the middle. Stay in the middle, okay? So, pick up the drape. Now, by the way, when you pick up the drape, and this is working in an area that this isn't sterile here, right? So if I'm going to open this drape up, I'm not going to open this drape up here to look at it. I'm going to step out into space where I know it's safe to open this up and I'm not going to contaminate anything. Now what I'm going to do is I'm going to walk over to this side. Now this is assuming you can walk. Now if you're doing this in large animals, sometimes you have to use a little matador action. But if you can walk around, do it like this, right? So what we're going to do is the same thing. We're going to go walk, put this drape in right in the middle of the incision. And then if I need a little bit more space, I'm going to pull it back slightly. I'm going to take this hand and I'm going to hold it right down there at the corner so that things stay put. I'm going to hold my hand out. My assistant here is going to properly hand the towel clamp to me. Proper handling of the towel clamp, handing of a towel clamp is just the way Marta did it because she knows what she's doing. But that is to say that the curve of the tip of the instrument should be up. Okay, so that when she hands it to me, hand it again, when she hands it to me properly, I don't have to look at it, okay? All I have to do is take it and use it, right? I don't have to flip it around until I figure out which, because these are meant to go in with the tips going down. I'm going to place it across the corner of the drape, getting equal parts of each corner of the drape, as well as a piece of the animal's skin. Now, we mentioned this before in the lecture, you don't want to be putting the towel clamp into the globe, right? Or the saphenous vein, or the cephalic vein, or what other things? There's some other things that would be bad. Okay, things that you wouldn't want a towel clamp in, don't put it in. That's all you have to do. So we've got one corner done, right? One corner is done. Now what we're going to do is get our next one, and same exact thing. We're going to open that up, get our hands protected, walk in, go to the center. If I want it a little bit wider than that, I'll pull it back. Now another question that people are going to ask is, well, how much space do you drape? Okay. By the way, when you put those clamps on, they go in fairly flat. That's why the curve is down. You don't put towel clamps in like this, okay? Because then they tend to stick up a lot. So put them in fairly flat because you want the towel clamps to lie flat so that you don't get your suture wrapped around it and so forth during the procedure. You want them out of the way. How much space do you have? There's a little bit of aesthetic involved there. Some surgeons are different. Leave yourself enough room to work. The last thing you want to do is be doing surgery. If you've got like a fairly substantial prepped area, you know, you can leave a little bit more room exposed so that you can easily get to see the skin edges, and you're not fighting with the edge of the drape. You don't want to be fighting with the edge of the drape, but you also don't want to leave more skin exposed than you need to leave exposed. Because what's the difference? This drape is sterile. The skin is clean. Okay? It's not sterile. Which gets me to a number of you, like, still are, based on the exam, still don't understand the difference between sterile and clean. Disinfected is clean. It's not sterile. Okay? Drapes are sterile. Skin is not sterile ever. Unless, of course, you autoclave something, which is bad for skin. All right. Now, I mentioned you can toreador action if you need to, and that is possible, but you still have to protect things. So if, suppose I couldn't get, this is a horse, and I couldn't get to that other side, you do need to learn how to do some, flip it around without, and get it accurately where you want it to be. Slide it into position, again, sliding from the sterile area to the non-sterile area. Put your last two corners together, okay? Last two corners together, and it should look, initially, something like that, right? Everyone got that? Pretty straightforward. Now, generally speaking, most surgeons look at that and they go, I don't really want to see those. So what they will next do is just take the towel clamp, tuck them under the edges of the drape as is shown here. Got it? Just tuck them under. And then when you look at it, it looks like that. Okay? And then you proceed with your surgery. Okay? Got it to that point? Any questions? Yes?
Is there a benefit to tucking top this at all?
Besides aesthetics? Yes, there is actually. When you come to when you start suturing, you will find out there's a benefit. The last thing you need when you're doing a continuous suture is to have the suture wrap around your towel clamp, right when you're trying to tie. And then you have to just you'd be surprised how often that happens. So if you have the option to tuck your towel clamps out of the way, tuck them out of the way. I think most surgeons would do that. Yeah.
Is there any benefit to the 4 drape technique versus the 1, aside from that you can use cloth drapes?
Question was, is there any benefit of 4 versus the fenestrated, other than you can use cloth drapes and so forth? They're both acceptable. This is probably the more applicable technique in a broader sense. In other words, using the fenestrated drape technique in some locations is difficult to do it accurately, and you have to do it, you have to lay it right on. So this is the more broadly applicable technique. You can always put a drape, if you can put the drape straight down, I'm never going to tell you that's wrong. Okay, now there's one other advantage of this basic idea that we did here. Anyone want to guess what that is? No, you can adjust it somewhat, that's true, but it's also thicknesses, right? If you think about this, most of the stuff that's around the sterile field has at least 2 thicknesses, right? Because it's already doubled on its edge. And in many places, it's 4 thicknesses of drape because we've got one lapped over another. So that's another advantage of using this particular type of draping. Other questions? We're doing okay for time. This is a good time to ask a question. No? Nurse Reburn, could you hold the horse's limb? No, back here is fine. So, now this is this is if you're working on a distal limb of a horse or a dog. Okay, they're done, or small animal, I should say. Oh, that's just a tennis boot. Yeah. I guess I can open it, but this is, I'll show you, this is a fenestrated drape. This is a lap drape for a horse, right? It's actually a smallish kind of a fenestration. But, yeah, just go to the large animal. But these are big, right?
Oh, yeah.
This is, huh? Yeah, this is a special made for ponies, actually. So the normal fenestration for a horse would be bigger than this. But the main point of this is just give you an idea of if you were going to use this on that growth, you have to actually have this thing open to the point where you knew where that was, and then you walk it right to it, drop it on, and go from there. It's just an example of fenestrated drape. No big deal. Now, no, we're just going to show them. I mean, this, we're going to show this document. So, or wrapping. So, there's, if you have the limb where it's sticking off, now, again, this is done slightly differently in small animals versus large animals, because in the large animals, it's very common for their limbs to be big enough that when we put them in a horse, and particularly in lateral recumbency, you can put them in a position where their leg is just hanging there out in, on a stand, and it's there. You don't have to tie it up in any sense. In dogs, it's very common when you're prepping it to have the dog's paw tied up with something that can be cut, okay? So like tape, usually some form of tape is the best thing to use. So, do we have any tape?
Any tape? No.
Any tape?
No.
Yeah. Yeah, there's cuffs, but that doesn't explain.
How about a link?
Yeah, that's good. Thanks. So yeah, the basic idea here would be that if you had some sort of disposable material, I usually use just white tape or something like that when I do it in small animals. So this would be tied to like to a IV stand or something like that that would be temporarily holding it in position. Can you hold that? Okay. So that would be held. Now, then I would come in. I'd be sterile. I'd come in to drape it. Then what I would do, okay, at this point was I could either use some sort of sterile wrapping, like sterile vet wrap or sterile. There's various types of sterile tapes. That what I would do is I would be able to grab. This is all prepped here at this point. I could hold this, okay, and then she would use non-sterile scissors to just snip it right next to that area. You wouldn't do this part. You just snip it, and now this would all be dirty. But I have sterile material that I could cover that with using my hands, right? Now that can be done with taping type material that's sterile, with sterile vet wrap or sterile adhesive products, either one. Now the other way to do it would be at this point, and again this is how we would normally do it in a horse, is that the horse kind of hangs there. And in that case, this would be non-sterile here, but sterile up there. So what we're going to do is use a sterile stockinette. Okay, now these should be of at least very water-resistant materials. In this case, it's typical draping material that's very fluid resistant. And we're going to hold it and put it on the hoof or on the paw if you were doing a small animal. And then what you're going to do is simply put it up to the edge of, you can kind of stuff it up to the edge of the non-sterile area. And then you're going to unroll it very carefully so that my sterile hands don't touch anything that it shouldn't touch. And then she's going to, I'll either pick up my own drape if it's on a sterile field, which that wasn't, or have an assistant hand it to me. So I'm going to take this and then I'm going to clamp the stockinette into the patient, and now we've got this area here ready to have surgery. Okay? That is, a very common technique to use a stockinette or a wrap for the distal limb. Okay, it's very, very specific for the distal limb. There's about no other application for it. Yeah, that was 140.
140, they should be.
Oh, okay. Well, yeah, out of here. Well, it's 1:35. I was done. Questions?